Eye infections are serious. They can lead to blindness or even death. Don't ignore them. Between January 2023 and February 2024, certain types of eye gel caused infections in at least 52 people. One person passed away, and 25 others experienced severe infections. Consider the case of the dangerous outbreak of antibiotic-resistant bacteria Burkholderia cepacia in 2023-24. When you think of eye infections, what comes to mind? Waking up with swollen, bruised-feeling eyelids stuck together with gunk? That gritty sensation in your eye that won't go away? Don't ignore these signs. Eye infections might seem small, but they can actually be very serious. The outbreak has calmed down and products are available again. But it's not the first time that medicines have caused B. cepacia outbreaks. This germ is dangerous for people with cystic fibrosis, long-term lung issues, or weak immune systems. The infection starts in the eyelids and can quickly spread to the lungs, causing pneumonia and blood poisoning, which can be deadly within days. Rubbing our eyes might seem harmless, but it can let in harmful germs that cause infections, leading to blindness or even death. Bacteria cause around 70% of eye infections, and worldwide, more than 6 million people suffer from blindness or moderate vision problems due to eye infections. When eye cells get damaged, they can't grow back. Our bodies protect our eyes by surrounding them with bones and using eyelids to shield them from harm and keep them moist. Even though our bodies try to protect our eyes, they can still get infections if germs get in. Conjunctivitis. The outer layer of the eye, called the sclera, faces exposure to many things. To shield it, there's a thin, moist layer called the conjunctiva. It has many blood vessels, and when germs get in, it triggers an immune response. This makes the blood vessels in the conjunctiva widen, causing pink eye, a common type of conjunctivitis. Pink eye can happen because of bacteria, allergens, or viruses, and usually gets better on its own. Blefaritis. Blefaritis is when your eyelids get swollen, and it usually happens on both sides. It makes your eyes feel itchy and gets flaky like dandruff. Usually, it's because of bacteria called Staphylococcus, or when the glands in your eyelids don't work right. Stye. A stye, also known as a hordeolum, is a painful infection that can occur on either the upper or lower eyelid. Internal styes happen when a gland inside the eyelid gets infected, while external styes develop at the base of eyelashes due to an infection in the hair follicle. They're usually caused by bacteria, specifically a type called Staphylococcus aureus. To treat a stye, you can apply a warm, clean cloth to the affected eye for about 5 to 10 minutes, 3 or 4 times a day. It's important not to try to pop or burst styes, as this could make the infection worse. Keratitis. Keratitis is when the clear part of your eye, called the cornea, gets inflamed. It's like a shield that protects your eye from dirt and germs. If keratitis gets bad, it can create sores and hurt your eye, maybe even make you blind. Bacteria usually cause it, but sometimes tiny amoebas can too. They can move around your body and make you really sick, maybe even die. If you wear contact lenses too much, especially while sleeping, it can also give you keratitis. This makes your cornea dry and scratchy, leading to inflammation. Uveitis. Uveitis is when the middle layer of your eye gets inflamed. It's not common, but it's serious and often caused by viruses like herpes or by injury. Symptoms can range from redness, pain, and spots in your vision to blurry vision or even losing some sight. Exogenous Endius. This infection is uncommon but very serious. It can happen after eye surgery, if something sharp pokes your eye, or if there's something foreign in your eye. Dacryocystitis. Dacryocystitis happens when the sac that carries tears from the eye to the nose gets inflamed. It can be short-term, long-term, or present at birth. Usually, it's caused by bacteria like Streptococcus pneumoniae and Staphylococcus aureus. This condition mostly affects babies and older adults, especially women and white adults. If tears don't drain properly, it can attract germs. And remember to be cautious with contact lenses. Keeping your eyes clean is really important, especially if you wear contact lenses. Make sure to clean your lenses properly. Using water, saliva, or other fluids can put harmful germs in your eyes. These germs love the warm, wet environment of your eyes and can cause infections. If your eyes are red, swollen, or hurt for a long time, see a doctor right away. If your eyes are consistently red, swollen, or painful, make sure to see a qualified healthcare provider for a checkup.